State records obtained by our investigators show assaults and physical confrontations between CPS workers and children in the foster care system have spiked, more than 6 times higher than the year before. It's largely because of an increase in the number of children sleeping in state offices and hotels. Investigator Avery Travis is following what's been labeled a capacity crisis in Texas.
Inside a CPS office in Austin, a child threatened to get a gun and hold it to a worker's head. Another grabbed a worker inappropriately. In Bastrop, a child repeatedly punched a worker in the face, head, and stomach. And when caseworkers took a child in their care to a park outside of Dallas, the child tried walking toward a busy highway before hitting a worker with a tree limb and slapping them in the face. These are just some of the dozens of incident reports obtained by KXAN that reveal assaults or sexual advances made on CPS workers by children living in state offices and hotels.
It's dangerous, Carrie.
That's what one worker confided to child welfare attorney Carrie Ward earlier this year.
It's a huge toll on these caseworkers, and if we're not losing them already, we will.
While data from the Department of Family and Protective Services shows the turnover rate among their staff is actually down this year, the number of physical altercations between those staff and kids is skyrocketing.
The records we obtained detail just one incident in 2018. There were 8 in 2019 and 9 in 2020, but the state reports detail nearly 60 of these altercations already this year, 6 of them involving kids living in Central Texas CPS offices.
It really makes children bear the brunt of the system's failures.
Kate Murphy with Texans Care for Children says several legislative efforts passed this year to improve the Texas foster care system. But her group was worried about 2 proposed amendments, one that would increase punishments for assaulting caseworkers, and another that would penalize kids for refusing a placement. Those ultimately failed.
The focus should be on how do we change the system to support these kids, not how do we punish these kids for what may have very well been a trauma response.
The brain is functioning from a place of fear and protection. So sometimes kids will be acting out from a place of genuinely trying to protect themselves.
Experts at the Austin Child Guidance Center work with kids in the system who've experienced abuse, neglect, or the trauma of being removed from their home. They say it's important for any adult interacting with them to try to rebuild trust.
But also to set up support systems for providers. Child welfare workers are human beings too.
It is a heavy thing to try to figure out the right answer and the right approach.
In a meeting last month, the Department of Family and Protective Services acknowledged the toll on staff and kids. A spokesperson told KXAN this week the situation has worsened dramatically after losing 1,000 beds this year alone due to the pandemic and increased oversight. Still, they said the agency is focused on making these locations safer while real solutions are in the works.
Avery Travis for State of Texas.
DFPS has a policy manual and a specific training course that agency staff must complete before supervising children. But as these locations become more crowded, the spokesperson said policies are being updated to support everyone's needs. A new COVID variant is surging in Texas, and it's infecting younger people. What doctors say Texans need to be doing now.